Right now, it seems like we all know someone who is sick, who has been sick with COVID, the flu, or even just the common cold, and it looks like it's going to get worse. Why? Well, check out the latest wastewater data from both the north, that's north of Boston, and this is south of Boston, and you can see that right now we have a spike. This is in COVID. And this was last year, so it hasn't been this high since last year. And this has been one of the best predictors of COVID trends. Another sign, the lines at urgent care clinics and ERs, well, they're growing, as Lisa and Dr. Malika Marshall explained. Guys?
Yeah, David, Dr. Malika is here with us now. You've worked in an urgent care clinic now for more than 20 years. It certainly seems bad. How bad is it?
It's really, really bad. It's as bad as I've seen it in all the years I've been doing it. I mean, the number of patients who came to the clinic yesterday was overwhelming. And of course, most of them had respiratory illnesses. Now, we're definitely seeing a sharp rise in flu and COVID cases and still a little bit of RSV. But there are clearly other respiratory viruses at play, ones that we don't generally test for and usually just label as the common cold or a flu-like illness. And clearly the surge has been largely fueled by all of the holiday gatherings over the past couple of weeks where germs can easily pass from person to person. So we're really feeling the pain right now.
Yeah, so you're seeing the spike, but we should be clear, not everyone who gets a cold or a cough has to go to an urgent care or an emergency room.
That's right. I would say most people actually don't. So if you're generally healthy and you have a sore throat and a stuffy nose and headache and cough and body aches, or even if you have a fever and you're managing your symptoms at home with over-the-counter remedies, you probably don't need to be seen. However, if you develop shortness of breath, chest discomfort, severe belly pain, uncontrollable vomiting, or you can't keep fluids down, then of course you should get immediate attention. Now, if your child is sick and you're concerned, call your pediatrician's office because they should have someone available by phone 24 hours a day who can give you advice over the phone and tell you whether you need to take your child to an urgent care or an ER. And yes, people are asking this, if you develop cold symptoms, you still should test for COVID at home, keeping in mind that it can take several days for a rapid home test to turn positive. So a negative test at the onset of symptoms does not mean you're in the clear, so keep testing.
Yeah, we have those flashbacks to the days of testing and testing and testing, but it's still important, obvious. Antibiotics won't help in these cases, but there are, in certain circumstances, antivirals that can help?
Exactly. So let's start with the flu, for example. We are prescribing antiviral medications for the flu pretty liberally right now, but ideally these pills should be started within 48 hours of the onset of symptoms, and certain people really should be treated, including young children, pregnant women, the elderly, people with asthma or diabetes or heart disease or other underlying conditions. So if you're in a high-risk group and develop fever, body aches, and cough, call your doctor to see if they can prescribe an antiviral flu medication over the phone. Now let's turn to COVID. We have Paxlovid, which is an antiviral medication that's typically used in people 50 and older, and again in those with certain underlying medical conditions. It should be started within 5 days of the onset of symptoms. So if you test positive for COVID, call your doctor to determine whether you should be taking Paxlovid. Again, that's something they should be able to send through fax or e-prescribe.
Hopefully all these sick people will be better soon.
I know, I hope so too.
Doctor, thank you.
You're welcome.
David?